Hi, I'm Dave Cooper. I'm a respiratory consultant with Northumbria and the Trust Lead for Lung Cancer. So cancer stages go from stage 1 to stage 4, stage 1 being the earliest stage and stage 4 being the latest stage with more advanced disease. Lung cancer is so dangerous because it's firstly a very common cancer, and unfortunately it's a deadly cancer. It tends to spread quite quickly and often won't cause any symptoms until it has spread elsewhere in the body. The later the cancer presents to us, the more limited the treatment options are, and so often by the time we diagnose a lung cancer, it has already spread outside of the lung, and that means that treatment options are more limited. So there's a number of different ways that we diagnose lung cancer. As part of our screening program, we're actively going out and scanning people and looking for cancer that hasn't yet caused symptoms. But more commonly, patients will present to us, usually via their GP or because of a hospital admission, with symptoms linked to that lung cancer. If we suspect a lung cancer based on symptoms, X-ray or scan findings, then the next step is usually to arrange a biopsy of that to tell us exactly what type of cancer we're dealing with, and potentially further scans to check exactly where that cancer is affecting in the body and whether it has spread elsewhere. Yeah, so there are different types of lung cancer. Essentially, it depends on the type of cells we find when we do a biopsy, and roughly speaking, we divide it into small cell lung cancer or non-small cell lung cancer, depending on the size of the cells on the biopsy. And then there are different subtypes of non-small cell lung cancer. So we may hear terms like adenocarcinoma or squamous cell cancer, which are the main two subtypes of non-small cell lung cancer. So no, all lung cancer treatment is not the same. And treatment very much depends on two things. It depends on how early we can pick that cancer up, and then the subtype of cancer on the biopsy. So at an earlier stage, the earlier we pick up any cancer, the more treatment options we have and the more effective those treatment options can be. So the idea of picking up cancer at an early stage is to find it before it's spread either within the chest or outside of the chest, and treat it with the intent of curing it, either with something like surgery to remove that tumour, or targeted radiotherapy to shrink it down and cure it. Unfortunately, as lung cancer spreads, it becomes less easy to cure, but there are still lots of treatment options available. And once a cancer has spread outside of the chest, we then think about using treatments like chemotherapy or other drug treatments, such as immunotherapy, where we can get the drugs on board and those drugs travel in the bloodstream to fight the cancer in the different sites of the body. So people often ask about the safety of the CT scan, and the way in which we scan people as part of the screening program is with a very low dose CT scan. So the amount of radiation given to the patient to obtain the scan is very low, and we know that that's very safe. So no, there are no side effects or risk factors with coming up and having the CT scan. So in the early stages, lung cancer tends not to cause much in the way of symptoms, but typically we say to watch out for a new or persistent cough, coughing blood, fatigue, weight loss, or a change in your voice. So yes, lung cancer can be cured, and that's exactly why we've been doing things like the screening project. The earlier a cancer presents to us, the more chance we have of curing it. And if we pick up cancer at an early stage, so typically when it's affecting one part of one lung and before it's spread within the chest or elsewhere in the body, we can cure that cancer with either an operation or high-dose targeted radiotherapy. Lung cancer does not only affect smokers, but we know that smoking is the biggest risk factor for developing lung cancer. Approximately 90% of cases are caused by a smoking history, but in addition, there are other potential risk factors such as dust exposure, heavy metal exposure, for example, through patients' working environments. And we know that all cancers get more common as people get older. So no, lung cancer does not mainly occur in men. There tends to be an equal distribution between men and women developing lung cancer, and that really ties in with risk factors such as smoking history. So no, you don't only get lung cancer when you're over 50. Patients younger than 50 can develop lung cancer. Again, that links into certain risk factors such as smoking behaviour. But we know as patients get older, the risk of developing any cancer goes up. And for lung cancer, we see that risk go up significantly over the age of 55. So we know that there are some genetic factors linked to developing lung cancer. However, these are very, very rare. So no, lung cancer does not show up on routine blood tests. However, there is a specific, more specialist blood test we sometimes do in the clinic, whereby we can look for certain cancer cells on a blood test if we've struggled to get the answer from a biopsy or other tests. So there are a number of different tests involved with the lung cancer pathway, from the scans that are done by the radiology department, the X-ray team, to biopsies that are usually done by the respiratory team. And if we need to do more specialist types of biopsies, they can also be done by specialist X-ray doctors or potentially other specialist teams. So being anxious about the appointment is really understandable and very common, and just because you've been referred into our clinic doesn't necessarily mean we're going to diagnose a lung cancer. But clearly someone's had concerns and we need to check things over. When you come to the clinic, there's a whole team to look after you, from the doctors to the specialist nurses, and we'll talk you through what needs to happen. If you're referred into us, it's really important that you come and see us because it may well save your life. So further information on lung cancer can be found in a number of different areas. There's plenty of really good online resources out there if people are on the internet, and otherwise contacting your GP or local pharmacist in order to be signposted to the most appropriate information.